I want to continue this discussion here on healthcare reform and bring in a member of Congress who has more than just thoughts on this issue. He actually has a plan. And joining me now to discuss this is Congressman Eric Burlison. He's a member of the House Oversight Committee. He also chairs the Subcommittee on Economic Growth, Energy Policy, and Regulatory Affairs. He represents the 7th Congressional District of Missouri. Congressman Burlison, great to see you again. Welcome back to Washington Watch.
Hey, Jody. Good to be back.
Okay, I guess one good thing, if there was any, that came out of the government shutdown is that it revealed to the American public some pretty critical information regarding Obamacare. And so let me just ask you, do you think the Democrats' so-called strategy to shut down the government probably backfired on them? Is that fair to say?
Yeah, I would think so. And I was really proud of Speaker Johnson and Republicans for holding the line, really proud that the president held the line and said, we're not going to give in to these kind of terrorist threats that the Democrats were making. But what the Democrats did is they kind of gave us a hand. They also had to, in order to ask for these subsidies, these enhanced COVID era subsidies to be extended, they had to admit that Obamacare is a complete and abject failure. And so now that we've had that discussion, now that that's been proven, I don't think it's a good idea for us to discuss throwing more money at this project that has clearly been a failure. If anything, this has given us an opportunity to do something big, something bold, something beautiful, and that would be a MAHA plan, something that Trump can rally behind, that gives people freedom and choice and lets people pick the insurance plans and the doctors and the networks and all of that they want.
All right, I want to get to that here in just a moment. But before we do that, a part of the issue in all of this Obamacare stuff is the growing pushback that we've seen against the continued funding of abortions, so-called transgender procedures. That really has been a red line, hasn't it, for Republicans?
It certainly is for me and for many Republicans. And that's where, whenever I've spoken to the speaker about this, I've said, strategically, I don't know how we could possibly, even if we were okay with extending these stupid subsidies that go to insurance companies, by the way, not to people, even if we were okay with that, we're not okay with allowing those to be spent on abortions. And so we would have to have some kind of hide language in there, which means that we'll lose all the Democrats' votes. And now you're talking about a reconciliation package potentially. And if you're going to do that, you might as well do what the American people want and pass some, a Republican solution, not just a patchwork on Obamacare.
Okay, that's a perfect segue. Let's talk about the plan that you have on this issue. There's been ideas floated around for a long, long time, but we're in full court press right now. So tell us about the plan that you're proposing.
Yeah, Jody, look, first and foremost, what I would suggest just politically that we should not touch the ACA, the Affordable Care Act, or any of those plans. We shouldn't touch really any of the insurance products that exist today. What we really need to do is create a new product that Trump can rally behind that simply gives people the freedom or the choice to choose. It's almost like a life raft out off of this sinking Titanic. And so, and the way this would work, every American can have a MAHA account, and they can fund that account with their own tax-free dollars, or their employer can get the tax deduction and fund it with their money, or a combination thereof. And then in addition, we will allow for individuals who are seeking charitable aid or help to be able to request that from their friends, their neighbors, from a charity, and that could come into their MAHA account as well. From that account, you're able to purchase a direct primary care. You're able to purchase any insurance product, and I mean any insurance product that you want. If you want to do health sharing plans, if you want to do an association plan, if you want to buy Obamacare through your MAHA account, you can. I wouldn't recommend it. I don't think anybody would be that foolish, but they will give you so many options that the American people will finally be able to choose which network that they belong to, which doctors that they are in network with. If they don't like a PBM or prescription drug management program, they can not choose to have one at all or pick a different one. This will suddenly put all of this decision matrix in the hands of the consumer, and suddenly you'll start seeing price transparency, because doctors and hospitals, they'll understand that if they want to get people's business, they'll have to do that.
What kind of reaction to this are you getting from your colleagues?
I'm getting tremendous reaction, overwhelming, really. And honestly, this is kind of common sense stuff. A lot of these ideas are things that Chip Roy we've talked about, members of Freedom Caucus. I've even heard Donald Trump tweet about this in a broad overview sweep, where the idea that's like unique to my plan is that, and in order to try to address the critical issue in America, which is that we're unhealthy. We as a people are some of the most unhealthy population of any country in the world. And when you look at the food that we eat garbage food. So we're spending less money per capita on food, and we're paying for it in the back end with expensive healthcare. And so if we can find some way to encourage people to purchase healthy food, and I mean protein, produce, and vitamins and supplements and fitness, then I think we can kind of get ahead of a lot of these costs. And that's where the MAHA plan works, because it provides each person a purse, a monthly purse of $150, where with your own money, tax-free money, you can go buy the steaks or the chicken or the lettuce, vegetables, whatever you want to buy, as long as it's unprocessed, healthy protein and produce.
Sounds like a great idea. We look forward to hearing more about this. Thank you, Missouri Congressman Eric Burlison. Happy Thanksgiving to you and your family. Thank you for joining us today on Washington Watch.